Hello, everyone, and welcome back to another episode of BrightLearn, where we dive deep into topics that matter, challenge the status quo, and empower you with knowledge. Today, we're exploring a groundbreaking book that could change the way you think about your health and the medical system as a whole. The book is What Your Doctor Doesn't Know About Nutritional Medicine May Be Killing You by Dr. Ray D. Strand. And trust me, this is a conversation you won't want to miss. Let's start with a question. How many of us have walked out of a doctor's office feeling frustrated, unheard, or even more confused than when we walked in? You're not alone. Strand, a seasoned physician with over 30 years of experience, shares a startling revelation. Most doctors are trained to be disease-oriented, not health-oriented. They study diseases, look for diseases, and are pharmaceutically trained to treat diseases. But what about prevention? What about maintaining health? That's where the gap lies. Strand paints a picture of a medical system heavily reliant on pharmaceuticals. In 1997, pharmacies in the U.S. filled over 2.5 billion retail prescriptions. Prescription drug sales have more than doubled in the past 8 years, and they continue to rise at an alarming rate. But here's the kicker. Despite this aggressive approach to treating chronic diseases with drugs, our quality of life is suffering. We're living longer, yes, but are we living better? Strand argues that we're living too short and dying too long. Now let's talk about prevention. Strand asks a crucial question. When you want to learn about protecting your health, who do you turn to? Is it your doctor? Surprisingly, less than 1% of our healthcare dollars are spent on preventive medicine. Most preventive programs are designed to detect disease earlier, not to prevent it. Mammograms, PSA tests, and cholesterol checks are all reactive, not proactive. Here's a shocking statistic. Less than 6% of graduating physicians receive any formal training in nutrition. Strand himself admits that for the first 23 years of his practice, he didn't believe in nutritional supplements. He used to tell his patients that vitamins were snake oil, or that they would just make expensive urine. But then, something changed. Strand's wife, Liz, was diagnosed with fibromyalgia, a condition marked by chronic pain and fatigue. Despite all the medications he prescribed, her health continued to deteriorate. Desperate for a solution, Strand decided to try something unconventional: nutritional supplements. To his astonishment, Liz's health began to improve dramatically. She regained her energy, her pain subsided, and she was able to resume her passion for training horses. This personal experience led Strand to question everything he thought he knew about medicine. He began researching the medical literature and discovered a wealth of studies supporting the use of nutritional supplements in preventing and treating chronic diseases. He found that oxidative stress, caused by free radicals, is the underlying cause of many degenerative diseases, including heart disease, cancer, Alzheimer's, and more. Strand explains that our bodies are constantly under attack from free radicals, which are unstable molecules that damage cells. This process is called oxidative stress. While our bodies have natural antioxidant defenses, they are often insufficient, especially in today's world where we're exposed to more toxins than ever before. This is where nutritional supplements come in. Strand advocates for a threefold approach to true preventive medicine: eating a healthy diet, exercising regularly, and taking high-quality nutritional supplements. He emphasizes that these supplements are not a replacement for a good diet, but a complement to it. He recommends a balanced mix of antioxidants like vitamins C and E, beta-carotene, and minerals like selenium and zinc. One of the most compelling parts of the book is Strand's discussion of homocysteine, a substance that poses a significant risk for heart disease and stroke. He argues that elevated homocysteine levels are a greater threat than cholesterol, yet many doctors don't even test for it. Strand recommends supplementing with B vitamins, particularly folic acid, vitamin B6, and vitamin B12 to lower homocysteine levels. Strand also delves into the role of coenzyme Q10, CoQ10, in treating heart conditions like cardiomyopathy. He shares the story of Wayne, a patient with severe cardiomyopathy who improved significantly after taking CoQ10. This nutrient is crucial for energy production in the heart and has been shown to improve heart function in numerous studies. But what about cancer? Strand argues that oxidative stress is a key factor in the development of cancer. He advocates for a strategy called chemoprevention, which involves using antioxidants to prevent and even reverse cellular damage. He cites studies where patients with precancerous lesions like leukoplakia and cervical dysplasia showed significant improvement after taking antioxidant supplements. Strand's approach is not about eradicating disease but about promoting vibrant health. He emphasizes the importance of cellular nutrition, which enables the body to function optimally. He believes that by supporting the body's natural defense and repair systems, we can prevent and even reverse chronic diseases. The book is filled with inspiring stories of patients who have transformed their health through nutritional medicine. From Mark, a young boy with Crohn's disease, to Charlie, a woman with cystic fibrosis, these stories demonstrate the power of supporting the body's natural healing processes. Strand's message is clear. We must take control of our health. We can't rely solely on the medical system to keep us well. We need to be proactive, educate ourselves, and make informed choices about our health. And that includes considering the role of nutritional supplements in our overall wellness plan. So what can you do? Start by evaluating your diet and lifestyle. Are you eating a balanced diet rich in fruits and vegetables? Are you exercising regularly? Are you taking high-quality nutritional supplements? Strand recommends a comprehensive approach that combines these elements to optimize your health. Thank you for joining me on this journey. I hope this episode has inspired you to think differently about your health and the role of nutritional medicine. If you want to learn more, I highly recommend picking up a copy of Dr. Strand's book. And remember, your health is your greatest asset. Invest in it wisely. Until next time, stay curious, stay informed, and stay healthy. Bye for now.
This has been a BrightLearn video from BrightLearn.ai on the book What Your Doctor Doesn't Know About Nutritional Medicine May Be Killing You by Dr. Ray D. Strand. Visit BrightLearn.ai for more fascinating videos like this one, and visit naturalnews.com for full editorial coverage and breaking news on critical stories that keep you informed and aware of what's really going on.